human hip is a marvel of biological engineering, a ball and socket joint designed to withstand the forces of a lifetime of movement. But when this mechanism fails, modern medicine offers a precision-engineered solution. This is total hip replacement, a procedure that swaps worn-out bone for high-tech titanium and ceramic components. The problem typically begins with osteoarthritis. In a healthy hip, a thick layer of cartilage cushions the movement. But as this layer wears away, the protective barrier vanishes. The result is bone-on-bone contact, where the rough surface of the femoral head grinds directly against the socket of the pelvis, causing inflammation and severe pain. If we look closer, we see the extent of the damage. The body tries to repair itself by growing new bone, forming jagged spurs known as osteophytes around the rim of the joint. The once round femoral head becomes deformed and flattened, making smooth rotation impossible and locking the joint in a painful cycle of friction. Doctors visualize this mechanical failure using X-rays. A healthy joint has a clear gap between the bones, but here that space is gone. The alignment of the leg is thrown off balance, and the structural integrity of the hip is compromised, confirming that surgical reconstruction is the only path to relief. The surgery begins with careful exposure. An incision is made on the side of the hip, and the large gluteal muscles are gently retracted. This reveals the capsule surrounding the joint, allowing the surgeon to reach the bones without cutting through the primary muscle groups used for walking. To access the damaged surfaces, the hip must be dislocated. The leg is manipulated to pop the femoral head out of the socket. This exposes the worn, arthritic ball and the damaged socket behind it, giving the surgeon a clear view of the work ahead. The damaged bone is then removed. Using a precision surgical saw, the neck of the femur is cut. The deformed femoral head is completely severed and taken out, leaving a clean, flat surface on the thigh bone ready to receive the implant. Attention then shifts to the socket, or acetabulum. A rotating tool called a reamer is used to grind away the remaining cartilage and damaged bone. This shapes the socket into a perfect, bleeding raw hemisphere, creating a fresh bed of bone that will bond with the new cup. A titanium cup with a porous surface is then pressed into this prepared socket. It is impacted firmly to ensure a tight, fret fixation. The rough texture of the metal encourages the patient's own bone to grow into it, locking it securely in place. Inside this metal shell, a smooth liner is snapped into position. Made of durable medical-grade plastic, this component acts as the new cartilage, providing a frictionless surface for the new joint to rotate against. Next, the thigh bone is prepared. The hollow center of the femur is shaped using a series of metal broaches. These files compress the soft inner bone, creating a tapered tunnel that perfectly matches the shape of the metal stem. The final titanium stem is then inserted into the femur. It is impacted until it sits tight and stable. Like the cup, this stem is designed to biologically integrate with the bone, becoming a permanent part of the skeleton. A new femoral head made of ultra-smooth ceramic is placed onto the neck of the metal stem. It is tapped gently to lock it onto the tapered metal, creating a rock-solid connection that will withstand the weight of the body. With all components in place, the joint is reduced. The leg is manipulated to guide the new ceramic ball into the plastic socket. It pops into place, restoring the mechanical linkage of the hip. Before closing, the surgeon tests the range of motion. The leg is moved in all directions to ensure the joint glides effortlessly without slipping or impingement. The friction is gone, replaced by smooth, silent mechanical motion. The deep tissues are then stitched closed, and the muscles are allowed to return to their natural position. The skin is sealed, and the physical work of the surgery is complete. But the true magic happens during recovery. Over the coming weeks, a process called Osseointegration takes place. Microscopic bone cells grow into the porous surface of the titanium, fusing the metal to the skeleton and creating a bond that can last for decades. The result is a restoration of freedom. The patient returns to walking, exercising, and living without the grinding pain of arthritis. The hip is aligned, the movement is fluid, and the quality of life is fully reclaimed. From a crumbling joint to a titanium solution, hip replacement is one of the most successful surgeries in modern medicine. Thank you for watching this skeletal alignment visualization. For more insights into the human body, subscribe to Surgery Visualized.